Hi, my name is N.garland. I'm doing my H&P assessment for neurological exam, cohort summer 2020. Alright, so hi, my name is Nicole. I'm going to be taking care of you today, and I'm going to be doing a neurological assessment on you. I'm going to do my hand hygiene, so that way you know my hands are clean. Okay, can you please tell me your name and date of birth? Okay, and can you tell me what year it is?
2020.
And who the president is?
Trump.
Alright, so the patient's alert and oriented ×4. So today I'm going to be doing a neurological assessment, which is going to test all the cranial nerves. We have 12 of them. So I'm just going to check and do a couple of different assessments involving your sense of smell, your vision, your hearing, and your muscles in your face, as well as your tongue and everything like that, okay? Alright, so the first one I'm going to check is your olfactory nerve to make sure that that's intact. So I'm going to have you close your eyes, and I'm going to have you hold one nostril closed, and I want you to tell me what you smell, okay? Go ahead and smell.
Alcohol.
Very good. And then go ahead and close the other side, and I want you to tell me what you smell.
Lemon.
Nice. Okay, so your olfactory nerve is intact. Okay, the next one I'm going to check is your optic nerve, okay? So I'm going to check your vision. Can you go ahead and read the smallest line that you can read?
LTFPH.
Okay. So the patient's visual acuity is 20/20 with both eyes. Okay. Next, I'm going to shine a bright light in your eyes. I'm going to check a couple of things. I'm going to check your red reflex in your eyes to make sure that your optic nerve is intact, as well as looking through your pupil with the ophthalmoscope to see the back of your eye, to check out the optic disc and your retina as well, and check out your pupil. Okay, so it's going to be a little bit of a bright light. Okay, so just go ahead and look straight ahead for me. Alright, just keep looking straight ahead. Okay. Now I'm going to look through the eye, so just go ahead and look straight ahead. Sorry if it's bright. So, let me see. Okay. On the other side. I'm going to put my hand on your forehead. It's hard to see when it's so bright in here. Okay. So, red reflex is intact. The optic nerve is intact. The pupils are equal, round, and reactive to light. I have not checked for accommodation. There's no hemorrhages in the back in the retina. There's no exudates noted, and the optic disc is round and sharp in appearance. Okay, so that's that one. The next test I'm going to be doing is to check for your extraocular eye movements, which is your third, fourth, and sixth cranial nerve, your oculomotor, trochlear, and your abducens. So I'm going to have you look straight at this pen, and I want you to follow the pen, okay? Perfect. Okay, so your extraocular eye movements are intact, and those nerves are intact as well. Okay, the next I'm going to check is your trigeminal and your facial nerve. Okay, I'm going to do a couple of tests here. The first thing I'm going to have you do is close your eyes, and I just want you to tell me if you could feel me touching you, okay? Can you feel it there? So I'm going to use a cotton tip, Q-tip swab thing, and I'm going to touch you. I'm going to tell you what each one feels like. So this is sharp, and this is soft. Can you tell the difference?
Yeah.
Sharp and soft, and then sharp and soft. Okay? So I'm going to have you close your eyes, and then I'm going to touch you, and I want you to tell me if it's sharp or soft. Okay?
Sharp. Sharp. Soft.
Okay.
Sharp. 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 Soft.
Perfect. Okay, you can go ahead and open your eyes. Okay. The next I'm going to have you do for me is I'm going to have you squeeze your eyes really tight shut. Okay, open them. Raise your eyebrows and wrinkle your forehead. Okay, smile. Stick out your tongue. Side to side. Puff out your cheeks. Okay, close your eyes again, and I'm going to have you try and fight against me. Close, 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 close. Perfect. Okay. Okay, I got everything. So your facial sensation is intact with no motor or sensory deficits noted. All right, so the next one is your 8th cranial nerve, the vestibulocochlear nerve. And what we're going to check is your balance and your hearing, okay? So I'm going to check the first part of your nerve, which is the vestibular part. So I'm going to have you stand up for me, right where you are. And I'm just going to have you close your eyes and hold your arms out. And I'm going to have you try and stand there and balance without falling over, basically. Okay, so you can go ahead and open your eyes and you can sit back down, and your Romberg test is considered negative, which is normal, so your balance is intact. The next test is your cochlear, which is the second part of that nerve, which is your hearing. So I'm going to do a couple of tests. I'm going to do a Weber and a Rhine test. The Weber test is going to check if you have any conductive hearing loss. So I'm going to tap this tuning fork and put it on the top of your head, and you're going to tell me if you feel it, if you hear it equally on both sides, or if it's louder on one side or the other. Okay, so that's the first part of the test. So I'm going to take it. Okay, I'm just going to put it here.
Yeah, I hear you.
Is it about equal?
Yeah.
Perfect. All right, so the next test is the Rhine test. And what I'm going to do is I'm going to do the same thing I just did there, except I'm going to place the tuning fork behind your ears and in front of your ears. And we're going to check for your air conduction and your bone conduction. So we're going to check for your sensory and your neuro hearing to make sure that those are intact as well. Okay? So your bone conduction should be about half as long as the air conduction. So what I'm going to do is I'm going to hit the tuning fork, place it right here behind your ear. You're going to tell me when you don't hear it anymore, and then I'm going to place it in front of your ear, and you're going to tell me when you don't hear it anymore after that. Okay? All right. So.
Okay.
Okay. Perfect. And I'm going to do the same on the other side. Okay?
Okay.
the last test on the hearing is a whisper test. So I'm going to whisper 3 letters on either side of your ear, and I want you to repeat back what they are, okay?
C-A-D.
Perfect.
D-O-G.
Perfect. All right. All right. So your vestibular, your 8th cranial nerve is intact. You don't have any sensory or neuroconductive or any hearing loss there. So, let's see. I did all those. Okay. So your next, the next test I'm going to check for is your glossopharyngeal, vagus, and hypoglossal. So your cranial nerves 9, 10, and 12. And we're going to check your gag reflex and a couple of how your tongue moves to make sure that the muscles there work as well and that nerve's intact. So the first thing I'm going to do is have you just open your mouth and say ah. And stick out your tongue. Say ah. Move your tongue side to side. Okay, I'm going to use this tongue depressor here. And so what I'm going to do is I'm going to put this on the side of your tongue, and I want you to push against it with your tongue, okay? So wait, let me put it in first. Okay, go ahead. Perfect. And then the other side. Perfect. And then go ahead and say ah. I'm going to check your gag reflex. Okay. All right. Gag reflex is intact. Thank you. Sorry about that. Okay, and then I'm just going to have you say these sounds for me. I, L, T, N. Perfect. Okay. So your palate is midline. No atrophy, no fasciculations, no spasticity, or no deviations noted. And your cranial nerves 9, 10, and 12 are intact. Okay, the last nerve I'm going to check for is your spinal accessory nerve, which is number 11. And what I'm going to have you do is I'm just going to basically put my hand on either side of your head, and I want you to push against me. Okay, so go ahead and push to the left. Perfect. And then push to the right. Perfect. And then I'm going to put my hands on your shoulders, and I want you to shrug against me. Okay, shrug. Perfect. All right, and that's it. So you have full range of motion against gravity and with resistance, and your spinal accessory nerve is intact as well. So thank you. This concludes our neurological assessment. I appreciate your time. Thank you. Any questions? No. Okay. Thank you.